So since 2016 pa yan. So that development has been going on. This is not an overnight success in quotation marks, right? So along the way, talagang maraming mga safety studies na ginagawa. We first looked at the bench work to look at the molecule and potentially how it would work. There were also trials among laboratory animals, in particular the weasel, because the weasel can actually transmit its own form of flu to its neighbors just by breathing. So, inaral na rin namin yun. Kaya nagkaroon kami ng idea that maybe by giving this drug also to people exposed to somebody who came down with COVID, like in a household, if somebody works outside and comes home, brings home pala the virus, COVID-19, and potentially is now going to infect the whole family, the whole household. So potentially, once we isolate or treat that one person, how about the rest? Can we do prevention by giving them also the drugs? So that's the phase 3 study that we're about to launch, looking at primary or post-exposure prevention of illness. And we will have 2 centers here in the country, one in the north of Metro, one in the south of the Metro. So hopefully, makasimula na tayo at the earliest possible time. We're still having to clear a few more requirements or approvals that are necessary before we can start the study.
Yeah, but Dr. Tamesis, all of this, is this supposed to be based on being tested first? Kasi, syempre, kung nag-positive ka na, well, sige, may tama ka na, di inom. Pero paano itong contact, exposure? They have to...
What if your spouse came down with the illness, nag-positive COVID na siya, and magkasama kayo sa kwarto, ikaw wala pang nararamdaman, can you start treatment? That's what we're trying to see. That's what we're going to study. Kung ikaw,
even without being tested?
Yes, even without being tested yet for COVID. So kahit walang symptom, wala pang test, kasi na-expose ka to somebody with COVID, diagnosed COVID yung spouse or yung partner or yung kasama sa bahay, can we prevent you or the other members of your household from catching the illness also? So that's the study that we're about to launch. Pero yung efficacy study, nangyari na yun.
What about in severe cases? Was this ever tried on severe cases or sorry, no go?
We actually did studies, but the trial was called Move-Ins for inpatients. And we found that the effect was nothing so dramatic. It wasn't dramatic at all. We felt that was the main reason, again, was because hindi na virus ang issue. It was no longer the virus multiplying, but rather the body's reaction to the virus. So it was really more of an immune system issue rather than a virus issue, which is why we went to early. Yung early exposure within the first 5 days of the diagnosis of COVID. So you have symptoms, you magpa-test ka, by the 3rd day, you know that you're RT-PCR or rapid antigen positive, gamutin na kaagad. So within the first 5 days, ginamot na namin kaagad yung pasyente, and that's where we saw this dramatic reduction in need to end up being in the hospital. We actually have ramped up production already. The company has already invested in manufacturing also 10 million doses, or 10 million courses, I think that's the word that we're using. 10 million courses have already been programmed, and we're ramping up production of these. Now, itong mga generic companies, we've signed them on since the end of April this year. So it's not just now in October na pumirma tayo. April pa lang, we've already signed with them. And some of them already have invested manufacturing. But syempre, they have to wait also for their own, they have to wait for some kind of regulatory approval